Okay, welcome back to another video on data relating to COVID-19. What we have here is a document that I'm going to link below from the World Health Organization. And it talks about classification of COVID-19 as cause of death. So this is the topic that we're going to talk about. When are you officially classified? Hopefully not you, but when is somebody officially classified as somebody that died of COVID-19? We're going to look at this document over here, and then we're going to look at the actual application of these rules. Okay, so first off, we have a document here from the World Health Organization that talks about international guidelines for certification and classification coding of COVID-19 as cause of death. Like I said, it's linked below. What we have here, purpose of the document, etc. And we're just going to go for the main information that we have in this document. So first, the purpose of the document. This document describes certification and classification and coding of death related to COVID-19. The primary goal is to identify all death due to COVID-19. So I would guess that this means causative, so all deaths that are caused by COVID-19. A simplified section specifically addresses the persons that fill in the medical certificate. So there's some practical application in this document of cause of death. It should be distributed to certifiers separate from the coding instructions. Second, definition for deaths due to COVID-19. You would think that whatever is defined here will then get out to the public. So somebody dies, you classify, you define him as died by COVID-19, and then this gets into the official statistics. We're going to look at that in a second. A death due to COVID-19 is defined for surveillance purposes as the death resulting from a clinically compatible illness, whatever that means, in a probable or confirmed COVID-19 case. This is pretty blurry here, a probable or confirmed. So what is a probable COVID-19 case? This is some guesswork. This doesn't look very clear cut to me. Unless there's a clear alternative cause of death that cannot be related to COVID disease, for example, trauma. There should be no period of complete recovery. So no period of complete recovery of COVID-19 between illness and death. Okay, let's see how that can be practically applied. A death due to COVID-19 may be attributed to other disease, for example, it may not be attributed to another disease, for example, cancer, and should be counted independently of pre-existing conditions that are suspected of triggering a severe course of COVID-19. This last passage is probably also not very easy to deal with, because let's say you have somebody that is in the terminal stages of cancer and then dies of, by this definition, of COVID-19, then this would mean that the person recovered from cancer to then die of COVID-19. So we're taking somebody out of one statistic and putting them into a different statistic. We look right now then on guidelines for certifying COVID-19 as cause of death, etc. And then this document goes on into chain of events. So how COVID-19 can lead to, in this case, pneumonia, and then acute respiratory distress syndrome. And then in this case, we have COVID-19 as cause of death. There are other examples where we have comorbidities. So here we have coronary artery disease, type 2 diabetes for 14 years, chronic obstructive pulmonary disease. So all these things this person is sick of and potentially in a terminal stage. Here is a suspected COVID-19 case, and it is counted as COVID-19. So here we have a case where somebody potentially died from something else, and there was just a suspicion of COVID-19, and therefore this is now statistically put into COVID-19. So this document alone leaves a lot of things to be wished for, because even though it tries really clearly to define, okay, this is causative, so COVID-19 causes the death, and still this document cannot very clearly separate these things. It will be absolutely always still be up to the individual how to deal with this. So to give you an example of how this can practically apply, or is actually an application, we look at an example here of Krefeld. Krefeld is a small city in Germany, And the article says that there are 27 people currently infected with corona. So this is in German, but I will translate it for you. So 27 people currently infected with corona. Then it says here, second heading, Krefeld, the government of the city, or basically the people that are responsible for the health statistics in the city, is reporting that the number of deaths has to be adjusted based on the system they have. There is nobody that died of a COVID-19 case, but they have to correct the number up. There used to be 22 people that died of COVID-19, and now, not having another case, they will have to put it up. Why is that the case? It says here, the reason is that once the person has been tested positive for coronavirus, and later died, they will be statistically listed as COVID-19 deaths. So this is obviously a little bit of a breach of the rule that the World Health Organization put out. This is not the city of Krefeld that wanted this, but they have to adjust their statistics because the National Institute, the RKI, the Robert Koch-Institut in Germany, classifies this case as a COVID-19 death. In this case, the person, middle age and with various comorbidities, initially tested positive and then was tested negative multiple times, and basically he recovered from COVID-19. Yet because he once tested positive for COVID-19, the German Institute says, the RKI, the Robert Koch-Institut says, well, therefore, he is now a COVID-19 death, putting the death toll in the city due to COVID-19, obviously not, to 23. Interesting. So what does it do? This is the same article again. I will put the links in the description below. Here is what we have in general then on the worldwide scene. We see that on the right-hand side, this is for Germany. So this is the global deaths today, 7th of July. We have 9,031 deaths in Germany. And this is on the side where we count COVID-19 deaths. And this is very close to what we have. Oh, let me close this. It's very close to what we have on the RKI, the Robert Koch-Institut side, where we have 9,024 cases. I'm not sure if the John Hopkins University is counting additional deaths because they have a different system. But those two look pretty close together, so about 9,030 deaths or so. But those apparently include cases where people died after some time before being diagnosed with COVID-19. They may actually have recovered still. So we don't know at all right now, with this information that we have, we don't know at all if these 9,024 cases actually died of COVID-19. Even though the World Health Organization says what the rules are, certainly we can see that there, if we can trust this article, well, these multiple articles about the case in Krefeld, that there is actually a relationship of having been sometime tested with COVID-19 and then getting already in the statistics of death. So this number right here is, for me, unfortunately not valid anymore. Because if you just put people in there that have sometime previously been tested with COVID-19 and could die of anything now, this is the practical application, then this is not really worth a lot anymore, unfortunately. This is absolutely besides the fact of the test. So the validity of the test is another question, but that'll be for another time, for another video. I'll leave you with this. So I'll put the links in the description below of, first of all, how in general the World Health Organization would like to see somebody classified as death, and then the practical application where we can see that clearly some people are classified as COVID-19 deaths, even though they have just been once diagnosed with COVID-19 and then die potentially completely unrelated and recovered from COVID-19. That's it for today.